So we initially looked at the anatomy of the serratus anterior muscle before looking at the nerve. Okay, so I felt like we should look at the nerve before looking at the this thing, but we are already did done. Okay, so here we'll be looking at this nerve that is very long from up going down. Okay, and hence the name they call it long thoracic nerve. Okay, so long thoracic nerve, we look at its anatomy. So we said that the long thoracic nerve is an important nerve in the body. Primarily is responsible for what? Innervating the serratus anterior. So these are the serratus anterior muscles from all these ribs. Okay, they are very they are spanning, they are very large. Do you understand? Hence the nerve has to be long to be able to keep up with them. Okay, so for the origin is from the brachial plexus. So they actually originate from the anterior rami, that's what C5, C6, C7 spinal nerves. Cause it's actually what? It descends through the neck, running posterior to the brachial plexus and the clavicle. It travels along the lateral chest wall. Okay, that's like the chest wall, like by the chest wall. Do you understand? By the chest wall. That's what they mean by lateral chest wall. Alright, innervation, like we already spoke, is the serratus anterior muscle. If you want to know much more on the serratus anterior muscle, you can comment, so I'll drop you a link which I made on the anatomy of the serratus anterior. So for the motor function, as it's supplying the serratus anterior, the muscle now is basically the motor function of the nerve. Okay, so the muscle is important for what? Protraction, moving the spine, the chest, this thing forward, such as when you want to push or punch somebody. You understand? So if the nerve is injured, you won't be able to push or punch. Do you understand? So you'll be having what is known as a winged scapula. Okay. So some common causes of injury could be traumas to the shoulders or neck, could be surgical complications, could be what? Prolonged compression to the long thoracic nerve. All of this can actually cause a problem. Okay, it will basically affect that action of the serratus anterior to protract, where you want to punch or push. That's it for the anatomy of what? The long thoracic nerve.